is Jessica and I will be your nurse today. What brings you to the ER?
I've had this terrible cough for probably 4 weeks now. I'm sweating at night. I've had a fever. I can't stop. With the chills.
Have you recently been sick or in any type of large crowd?
I went to a Lil Wayne concert a couple of weeks ago.
Sure how you say it. Have you been diagnosed with any health issues in the past?
Yeah, I am HIV positive.
Okay. All right, I'll notify the doctor of your symptoms and she'll be in shortly, but in the meantime, I'm gonna get your vital signs really quick, okay?
You can come in.
Good morning, Ms. Betts. I'm Dr. Wiggins. How are you doing today?
I've been better.
Okay, well, the nurse has informed me of your symptoms that you've been having for about a month now. So due to those symptoms and your medical history, we're going to run some tests to rule out tuberculosis.
Okay.
All right. So do you know what TB is or what tuberculosis?
I don't.
Okay, so that's a bacterial infection in your lung. And the quicker that we diagnose it, the sooner that we can start treatment.
Okay.
So what we're going to do today is we're going to run some blood tests. We're going to do a sputum culture, and then we're also going to do a chest x-ray. Does that sound okay?
Sounds good.
Alrighty.
Thank you.
You're welcome.
Ms. Betts,
Hi.
Dr. Wiggins has ordered a few tests for us to run on you, okay?
Okay.
So the first thing I'm gonna do is get a sputum test on you. So I'm gonna have you spit into this little cup, and then we're gonna send it for a culture. We're gonna do it again for the next 2 mornings, okay?
Ms. Betts, we have your test results back. Okay, so your sputum smear showed positive for tuberculosis.
Oh no.
Your left lung has lesions, which is also an indicator of tuberculosis.
Okay.
Your labs show a high white blood cell count. That means that your body is currently trying to fight an infection. And then also what we're going to do is we're going to start you on a regimen of 4 medications. The first 4 medications are rifampin, isoniazid, pyrazinamide, and ethambutol. You're going to take those for 2 months.
Okay.
After that, you're going to continue the rifampin and isoniazid for 6 to 9 months. And the reason being that you have to continue those for so long is because you are HIV positive. Okay. Now, your nurse Jessica is going to get you started with the medication right away.
Okay.
All right, Ms. Betts, I have your medications here, the 4 that Dr. Wiggins talked about. And I know you asked about the side effects of these medications. All right, for rifampin, the #1 side effect to remember is it will change your bodily fluids orange. So if you have orange sweat, orange urine, is nothing to be concerned about. It is a side effect of that medication. And for the isoniazid, it interferes with your absorption of vitamin B6, so you will have to take a vitamin B6 supplement. For the pyrazinamide, the major side effect is photosensitivity.
What is that?
That is sun exposure. So you have to limit your sun exposure in UV lights, use sunscreen, wear brimmed hats and sunglasses. And then for the last medication, the ethambutol, it has changes to your vision. So you have to watch for blurred vision or color changes, and you need to have your eye exams on a regular basis, okay?
Oh, I'm already blind. This is going to be terrible.
All right, and I have these medications for you, the 4 to start that Dr. Wiggins said you have to take for 2 months, and then you'll take 2 of the medications for 6 to 9 months, okay?
Okay.
Hey sis, what's going on? They made me put all this stuff on.
Girl, I'm never going to a concert again. I have TV. Yeah, that was my reaction.
Oh my gosh.
I'm sorry.
Oh
Good,
my
get away from me.
Oh.
Good morning, Miss Betts.
Hi.
Finally getting out of here today.
Ooh,
Oh, who do we have here?
this is my sister.
Crystal.
Hi, Crystal. Nice to meet you. Is it okay if I talk to you in front of Crystal?
Yes, ma'am.
Right. I just have a few things I need to go over with you. It's your discharge paperwork.
Okay.
We're going to get you out of here, okay?
Okay.
So let's get started.
Do we know how she obtained TB?
So we are not 100% sure how Ms. Betts obtained TB. So she does have the risk factor that she is HIV positive in her recent outing to a crowded event, the Little Wayne concert. It is likely she came in close contact with someone who had TB, and it is spread by airborne droplets. It is not spread by touching objects or anything, so someone she was in close contact with may have been coughing or sneezing around her, and she breathed in those droplets.
I told you not to go to them concerts.
Lil Wayne, man. I love him. It was fun. I had a great time and I don't regret it.
Well,
Except-
do you think I need to get tested because we're always together?
Might as well. You probably need to.
So we do recommend that family members and friends that are in close contact with someone who has active TB does get tested. You can call your primary care provider and have a PPD test done. That is where they will inject tuberculin right underneath the skin, and they'll read it within 48 hours. And if there is a reaction, they measure it, and then that will let them know if you have active TB or not.
Well, let's take care of you first.
So she will have to take 4 medications for 2 months. And then after those 2 months, Dr. Wiggins has her on a regimen where she will take 2 of those 4 medications for 6 to 9 months. And it is very important that you complete the whole treatment course of your medications, okay?
You hear that? So what about the foods? What can she take and what can she not eat?
All right, yes ma'am. With TB, there are certain foods that we do recommend avoiding. We do have this poster here that we did it like a little visual. So the things that you should avoid are caffeine, alcohol, fast foods. We encourage the intake of high protein, vitamin A, vitamin C, and vitamin D, such as fruits, eggs, carrots, milk, and vitamin D supplements. Since you cannot go out in the sun because one of the medications, you have a photosensitivity.
What about our beach trip this summer?
Oh no.
I think I remember reading sometime since I've been here that once you have TB, you always have it. Is that true?
Yes, that is true. Once you are diagnosed with TB, you are always going to have TB. Just means that your symptoms will not be contagious. You won't have active symptoms.
Okay.
We call that latent TB. So you will have the TB in your body, but it's not activated. You can go years without reactivation of your TB symptoms. Even though you have it, like I said, you are not contagious, even though you have latent TB. It's only when you are experiencing symptoms such as coughing, sneezing, fever, sweating, when you are contagious.
Thank you guys so much. You've been amazing. This experience is 10 out of 10.
Oh, thank you. Just to ensure you understand everything we went over today, will you please teach back to me a few things that we went over?
Alright, no more concerts. No more crowded situations. My family will get tested. I will cough and sneeze into a napkin and get rid of it right away. I'll eat healthy foods.
And what's the most important thing you're going to do?
I'm just gonna complete my entire course of treatment.
Yes.
Take my medications, and I will not go out into the sun.
And make sure you have eye exams regularly.
Yes.
And stay
Yeah.
up to date on your vaccines.
I will get all my shots. I promise.
All right. Well, it was lovely taking care of you, and I hope you get better and you take care of yourself. And it was nice meeting you.
Nice
ma'am.
meeting you too.